Hi there, it's Dr. Green, founder and CEO of Regen Suppliers. Today I'm going to talk quickly about ReBellaWJ, which is the best FDA 361 umbilical cord allograft available. All right, we'll go through quickly what is an HCTP, what does the FDA mean by 351 versus 361, and how ReBellaWJ falls into the 361 classification. Disclaimer, I'm not an attorney, just wanted to point that out. All right, what's an HCTP? Human cell, tissue, and cellular and tissue-based products. HCTP for short. The FDA created that term to distinguish what needs full FDA approval versus simply being regulated by the agency. So they put out a documentation in 2020 which describes just that, and a lot of this is copy and paste from them. The FDA is pretty clear, but there are still players in the industry who love to disseminate false information regarding what's in that handbook. All right, here's what's in the handbook. Basically, 351 is considered a biologic, which basically needs a full clinical trial for approval, while 361 is an HCTP, and it's not required to have a full clinical trial. The difference then is that with a clinical trial, you can have a specific therapeutic use. You have a, quote, label, whereas with 361, you do not. Potency and purity is assured as part of that process. That's not necessarily tested for a 361, okay? Now, as a 351, the reason products fall in that category is because the FDA has two terms, minimal manipulation and homologous use. So either a 351 product is more than minimally manipulated or it's not intended for homologous use. For a 361, look at number one. The HCTP is minimally manipulated. Number two, it's intended for homologous use. Number three, it doesn't involve combining cells or tissues with another article, but you can use water, crystalloids, sterilizing, preserving, or storage agent. All right. So cryogenic preservation does not change it from an HCTP. Now look down here in 4. The HCTP does not have a systemic effect, and it's not dependent upon the metabolic activity of living cells for its primary function. So it can do that as a secondary function. All right, we'll talk about that in a moment. All right, so minimal manipulation is very simple, processing that doesn't alter the original relevant characteristics of the tissue related to its utility for reconstruction, repair, or replacement. And I wanted to point out that right off of the FDA handbook is umbilical cord, 361. So a couple very important points. These tissues, HCTPs, can have live cells. That doesn't exclude them. And it just means that that's not going to be their primary function, right? They can have a local metabolic effect as well. It can't be systemic. So it can have live cells. It can have a local metabolic effect. Competitors love to use this because they'll say, oh, it has live cells, it's a 351. That's not necessarily true. Either they haven't read the guidelines or they just want to twist the facts. So the umbilical cord matrix provides structural support, cushioning, lubrication, and protection. ReBellaWJ has the umbilical cord matrix, and it's an example of a minimal manipulation product. So what is the definition of homologous use? It means the repair, reconstruction, replacement, or supplementation of a recipient cells or tissues with an HCTP that performs the same basic function. So it has to be same function from the recipient as it's going to be from the donor, okay? Now, an example, umbilical cord matrix allograft is used in a joint to provide cushioning, support, protection, lubrication. That's homologous use. It's the same function. Same. And that example is the ReBellaWJ product. ReBellaWJ is a minimal manipulated allograft. There's no culturing, enzymes, things like that make it into a 351, derived from full-term post-C-section umbilical cord Wharton's jelly tissue. And is homologous use intended? It's intended for structural support, providing cushioning, protection, and lubrication. What types of tissues can receive injections? Well, let's say joints and soft tissues. If you're providing structural support for the joint, you could also use it to provide support for nerves, vessels, follicles. With the 361 HCTP product, it's the medical providers who decide which patients are well suited according to the practice of medicine. The FDA regulates the products. The providers are practicing medicine. They can discuss the effect of live cells as a secondary local metabolic function, if desired. So Regen Suppliers is an exclusive distributor supplier of ReBellaWJ, which is an umbilical cord allograft tissue. It's 361 HCTP compliant. So new customers can get a 2-for-1 on the 1cc and 2cc vials. It's a great product. Please call us today at 888-568-6909 and visit us online at regensuppliers.com.